It's great to come here and speak to yourselves. You know, Obviously some of our key allies in delivering this cleaner air work in the NHS setting is often the sustainability teams, and it's great to speak to a collection of people who many of whom are in that space as well. So my background is in hospital medicine, actually. So I've worked for over 10 years in that field, mostly in Glasgow hospitals. And I've been with Global Action Plan for about 3.5 years. I just go back and do an occasional shift to keep my hand in with the healthcare work as well. So yeah, a lot of that work has been directly in the education of healthcare professionals about air pollution so that they can pass this learning on to their patients, but also working to help the NHS tackle its own air pollution problem, so to speak, more broadly. And that's been working through elements such as the Clean Air Hospital Framework and more recently the ICS Cleaner Air Framework. Yeah, and so this talk, it will have elements which is essentially the material that I teach to healthcare professionals, but it's also from a slightly different angle because I'm also trying to gently encourage trusts to do more in educating their healthcare staff rather than it just being a direct education session, and thinking about that wider picture of what the NHS can do as well. Fine. And so therefore, the simplest thing, too long didn't read, would be the air pollution impact us all. And that really is from, unfortunately, before we are born, all the way through until older age. And I say before we're born because unfortunately air pollution has a significant impact on the growing child, particularly the unfortunate risk of miscarriage being higher, the size of the baby growing in the womb, and the chance of premature birth or anything like that, all very significant problems, and all the way through until older age. Fine. And so, yeah, I know that Maddie's going to talk about this later, but obviously Clean Air Day just around the corner. I always make sure to plug this no matter which time of year it is when I'm speaking to the healthcare professionals, because it's, yeah, that really key day in the year in the UK's fight for cleaner air. It's definitely also worth saying that healthcare settings and healthcare professionals themselves really do drive home powerful messages about air pollution on Clean Air Day. So it's great to have so many involved. Anyway, usually I look at the international picture, considering the impact of air pollution globally. And unfortunately, it starts with some pretty stark statistics because the vast majority of the world's population live in areas where even just one type of air pollution, particulate matter, exceeds the WHO guidelines of 5 micrograms per meter cubed. And another pretty significant statistic is that cardiovascular disease accounts for about half of the mortality from air pollution, which I think a lot of people don't realize. Very clearly, this is the case with healthcare professionals as well, because inherently people can understand that respiratory disease is closely aligned with air pollution. They might not think about it that much, but they can sort of intuit it quite well. But when actually we look at the statistics, it's actually cardiovascular disease. The relatively low level impact, but in the short term, but actually across the long term, is that long-term impact which causes the significant impacts on cardiovascular disease. This graph requires a tiny bit of explaining. Essentially, if you took the total amount of impact from air pollution, which is spread around the entire population of the world, then unfortunately it has an impact comparable or even greater than that of smoking. And so that's in the region of 2 years and 2 months, or 2 years and 3 months. And the reason that the number from smoking isn't higher is because not everyone in the world smokes. So for each of those people individually who do smoke, they probably have a much more significant impact on their life expectancy. But averaged out across the world, because the vast majority of the world's population live in areas where air pollution is higher, it means that the total impact of air pollution is itself higher. Now, I think these figures could do with slightly updating, but you can really see as well, in terms of the amount of financial support given to projects relating to air pollution, they're absolutely dwarfed by the impact that it has on mortality around the world. And you'll never get me saying that the air pollution, the funding for these other health conditions should be reduced. But as you can see, it's similarly dwarfed in terms of the amount of funding that you get compared to these other serious conditions. So very quickly, this slide unfortunately summarizes the countries with the worst air pollution problems in the world, many of which are in the Indian subcontinent and across Africa. But you'll see as well that, yes, with Bangladesh, nearly 5 years of life on average are lost. So there will be parts of the country where it's much worse than that and parts of the country where it's better. So a really disastrous statistic. In the UK, in comparison, the issue is not nearly so severe. However, as we'll see, this still has a significant impact on the UK's population. And even still, we can still say comfortably in parts of the UK that about 6 months of life are lost on average per person because of air pollution. And again, because this is an average, there will be parts of the country or even a region where the air pollution impacts are worse and areas where it's better. And this is something that I come to quite often in my chats, my talks about the impacts of air pollution to healthcare professionals, is that the impacts are not felt equally in society. And so even in, we can consider regionally that the impacts of air pollution are different. Even across a single city, it's significantly different as well because of areas of significant deprivation, or people who live right beside a major road, or if they have significantly poor housing or anything like that. These are all factors which mean that air pollution is a significant health inequality, essentially. Fine. And so despite recognizing that it was a relatively small impact in the UK, mostly because of legislation which has come over the last 70 years or so, air pollution still has a massive impact in the UK, causing up to 43,000 deaths each year. It causes a very significant number of sick days each year. And if we think about the significant number of admissions coming into our A&Es or directly into hospitals because of air pollution relating to lung and heart problems, you can easily see how this rapidly stacks up to an enormous burden in terms of the cost to the NHS. And of course, each one of those admissions is a person. So, we need to never forget that too. Fine. And so I'll talk a little bit more about this. There will be some slides that I skip more past in the interest of time, but many of you will be familiar with the tragic case of a young girl called Ella Adu Kissi-Debra, who lived essentially just off the London South Circular. And unfortunately, she had a very vulnerable, friable form of asthma, which meant that she was admitted many, many times in a couple of year period relating to air pollution. I think it was about 25 times or so. And because she lived right beside an air quality monitor, actually, it meant that in the inquest to her death, we could actually put air pollution as a contributing cause of death on her death certificate. And this is the first time in the world, as far as we know, where this has been the case. And so the Royal Colleges and other healthcare institutions were called upon in the coroner's report to do more work relating to air pollution because Rosamond, who is Ella's mum, who still campaigns to this day very powerfully on air pollution, essentially recognized that she'd never really heard about air pollution being a significant impact relating to her daughter's asthma. And so the colleges got together, they recognized the issue, they over time have actually gone about educating some elements of the workforce, and they are doing some good work in that space, but I think that there's still a lot more to be done. And of course, some of these changes require systemic changes in our society, and so that they came up with a number of thoughts related to this. Of course, that different air pollution messaging will need to be tailored differently to different groups in society. They recognize that health professionals are indeed good people to bring this information to our patients. And actually, even if the last one here might suggest a negative thing, but actually I see it as quite positive, is that health professionals don't necessarily need to become true air quality experts in order to be able to pass information on to patients. And that has been the case, I think, in the many times when I've delivered these teaching sessions to colleagues up and down the country. So I probably will not dive deeply into the types of air pollution because I think most colleagues on the call have at least heard of them. Of course, you will have heard of nitrogen dioxide and particulate matter, and these are the ones most commonly seen in like academic studies and in like international or national targets in terms of, they recognize the seriousness of these types of air pollution. And of course, aside from that, we have ammonia, sulfur dioxide, and then these volatile organic compounds. And here on this next slide, we often talk about some of the major sources of these. I won't go into enormous detail on this, but for example, ammonia, the biggest source of this is agriculture. A lot of that is from the feces and urine from livestock. And as many people will know, this can run off into waterways, but actually it also contributes quite significantly to air pollution. In terms of particulate matter, that's has quite a big spread across different areas of society that generate particulate matter. But one of the biggest ones that I think is often not considered is actually domestic burning, which is to say wood burning stoves, open fires, and the like. And one area that I will certainly speak to commonly when I'm talking through this sessions with healthcare professionals is because we're wanting to encourage them to speak to their patients about it, we need to recognize the context in which the patient lives. And by that, I mean, like, with the example of domestic burning, many patients and individuals, especially within urban settings, will actually have another heating source already. They will have their gas boiler in many cases, or an air source heat pump, or anything like that. And for them, actually using the wood burning stove is essentially aspirational. It is sort of getting that cozy feeling. It's a secondary heat source. There are some people, however, who, especially in a cost of living crisis, are essentially just burning whatever wood they can find in order to keep warm in the winter. And recognizing the context in which the patient lives is very important there. And another one I often talk to is transport, because unfortunately, transport is the biggest source of nitrogen dioxide still, particularly individual car use. And as we know, this is very harmful to people's health. But if you're speaking to a patient, a mother of three, and she has to go between two schools and then off to work in the morning, and if you turn around to that mother and say, well, of course you're not going to drive anymore, then you've not recognized the context in which the patient lives. You've basically lost them. They don't think that you are communicating with them realistically. So yes, I think that this is always important to consider, while at the same time recognizing that there are some things that people can do. And if we've got a big long list of actions, as we'll see, that people could do, people in general will be able to do some of them, but they might not be able to do all of them. Anyway, carrying on. Fine. So even more quickly, I'll go through some of the indoor sources of air pollution, and indeed recognizing that indoor air pollution is enormously important because it has significant impacts to people's health. People obviously spend a lot of time indoors, anything between 50 and 90% of their time usually, and there are some important sources in the home which people maybe haven't thought of before. And one that we've done a lot of work on recently actually is gas cooking. Now, again, people won't necessarily have thought of this before, but actually by burning gas in the home, you are releasing nitrogen dioxide particularly, and other pollutants. And this is harmful to people's health, and we know that it causes cases of asthma, and it makes cases of asthma and other respiratory conditions worse, amongst many other health concerns. I've already mentioned things like burning in the home. Like even candles and incense and stuff like that are unfortunately quite harmful. And then there are many things like, say, VOCs, which is to say chemicals that we know that float around in the air, often generated by human activity, and these are harmful to human health. And so things like strong smelling things, almost always contain some element of VOCs, so things like hairsprays, perfumes, nail polishes, and even fire retardants and things that would be sprayed on furniture and other things like that too. However, interest of time, I'll move on. This, I think, probably familiar or very similar image could be generated anywhere across London and indeed in many towns and cities across the country. This is not, someone hasn't come along here with a black pen to draw where the roads are. It's essentially just highlighting that for this nitrogen dioxide related graph, where it's been modeled across the city, and this looking at Islington here, you can see that the roads are very neatly marked. The bigger the road, the darker the line, essentially, in terms of the levels of air pollution. And as you move down in towards the city, I don't know if you can quite see, even the background levels of air pollution are in this really quite dangerous level. And as people may well be familiar, the UK is looking to potentially change its air quality targets, and so we would hope that this would, this legal limit that is arrowed here would actually be much more ambitious, essentially. However, I would normally share a video with the healthcare professionals, which in the interest of time I will not, but it's a very nice little video. It lasts just about 4 or 5 minutes, and it is essentially a GP based in the Manchester area who cycles her commute to work, but measures air quality as she goes, and unfortunately finds that levels beside the major roads and indeed beside a school are particularly high. So quite a powerful message. Oh, I think that is just playing now. So yeah, I'm just going to skip past in the interest of time. So yeah, I will not read all of these out, but another important factor of air pollution is also to recognize the impacts that it has across the body, not just throughout the life cycle. Some of the obvious ones that you would expect in terms of lung diseases, I've already mentioned about cardiovascular disease, which includes strokes. And it's said, for example, that about a quarter of all deaths related to heart disease and a quarter of all deaths related to stroke can be attributed to air pollution. A couple that I think are very worthwhile mentioning are related to the development of children, which is to say that their lungs, as they're developing, will be essentially smaller, effectively less grown in areas of high air pollution. And the same, unfortunately, can be said for their brain development. They are less fully developed brains in areas of high air pollution. And this can also be shown in terms of their learning, essentially. So kids in areas of particularly high air pollution will have poorer learning compared to areas where that is better. And that is shown in large-scale studies. So anyway, the body has natural defenses against air pollution, and that includes essentially the mucus and the hairs lining the airways, and that goes all the way down into the alveoli, which is the air sacs at the ends of the lungs. And unfortunately, because of gases and the sheer volume of particles floating around in the air, many of these essentially bypass the body's defenses or overwhelm them, and then they can get into the bloodstream. And then that's the reason why air pollution impacts you all the way around the body, essentially, because it does have this significant irritation effect throughout the bloodstream. So it means that lots and lots of blood vessels become irritated or inflamed, and that can cause these effects throughout the whole body, essentially. Fine. I've already mentioned elements of this, but it's definitely worthwhile mentioning again, is that air pollution is a great, a really terrible, therefore, source of inequality in terms of healthcare and health outcomes for many people, such as those listed here. Fine. And here's a section I think I'll skip past to some degree, but essentially, having taught people about the international, the national picture relating to air pollution and some of the ways that it impacts the body with the healthcare professionals, I then think about how to integrate these messages into the experience of the patient, as in can we integrate it into the consultation directly with the healthcare practitioner, but also there would be examples such as even before the patient gets in the door, they might see a poster. There are lots and lots of different opportunities, and it was great to hear about that that example that came up in this call where people were talking about putting it on A&E screens. I've also seen posters of ours up in hospitals across London, and so it starts questions. It starts people thinking about it, and if you can get a patient to get multiple levels of interaction in terms of considering air pollution over the course of their admission or clinic visit, etc., then it means the message is more likely to hit home. So I actually talk to the healthcare staff about how to integrate it into the consultation as well. So that's a nice part of the discussion too. And then we start thinking about how to follow up as well. So many people will be familiar with link workers or social prescribing, and that can be an opportunity. For example, you've got a walking group that a GP will refer to, trying to ensure that that walking group goes through green spaces, as in it doesn't just march down the side of a busy road. That will reduce the exposure that the patients have, and yeah, that's a very good thing in itself. And because we've got electronic versions of all of our leaflets and posters and stuff like that, that doesn't mean that the health professionals can specifically ping them off to patients after their consultations. I'll glance past this, I think, in the interest of time, but there are many, many different types of consultation that happen every day, of course, and some of them are more obviously related to air pollution, you could argue, but other ones could be more seen as opportunistic moments that a patient's getting their blood taken, maybe they get handed a leaflet at the same time, just as an example. Fine. I think many of you will have heard of the Clean Air Hub. This is a patient-centered, patient-focused website, which essentially is for the general public, and it's in order to tell them more about air pollution so that they can learn about it, essentially. Fine. And then we just bring up this example leaflet, which developed for a recent project related to cardiovascular health, in which we have taught 25 cardiovascular healthcare staff about air pollution so that they can pass this learning on to their patients. On one side of the leaflet, it talks about a lot of the health concerns and the issues that we've already talked about here. It does, however, recognize that there are some things that people can do about it, and it points them in the direction of the Clean Air Hub as a means to find out more information. And then on the second side, importantly, it talks about many of the ways in which we can reduce our exposure to air pollution as individuals, but also our contributions to the wider society's air pollution as well. And again, I will not go through all these in detail, but on the left, it's got many of the outdoor air pollution sources, and with many of the solutions being related to active travel. And then on the right-hand side, it's about indoor air pollution, mostly focused on the home, but of course, many of these would apply to other sites, such as schools and hospitals, etc. as well. Still, interesting stuff. And thankfully, these leaflets have tended to be very, very popular. And I think, they effectively state the case and tell people how, instead of just it's all doom and gloom, they tell them that there are some things that they can do about it as well. Fine. Well, we've also got our Action for Clean Air site, which has lots and lots of resources, essentially, which have been generated throughout the years of health work that we've been doing. Even just one to highlight there, the one with the balloons and the smoke on it, was generated with Barts Health Trust for a short project that we were doing. And if you go through essentially many of the main hospital sites across Barts Health Trust, they have these banners, these sort of anti-idling banners hanging up around their car parks and beside their main roads, etc. So yeah, just even saying loads of different types of resources, they're all free and they're just very much there to be taken. And if someone wanted to use them in a big way, then by all means reach out to us and we'll see what we can do to help. But at the same time, they are there to be downloaded and used as you need. Okay, just a couple of examples of those posters. I'm not going to read through them there, but yeah, lots of things available. So some of the top line messages I like to give to patients, or rather to healthcare professionals so that they can pass it on to their patients, is that air pollution is a serious issue. It impacts everyone, and in particularly some people who are more vulnerable. But there are some things that we can do to reduce our exposure, and some things that we can do to reduce our contributions to air pollution as well. Fine. I'm going to glance past this, even though it was a really, really great study and project that we did teaching a number of primary care health professionals about air pollution in the Islington area. Essentially, if you teach people, they know more about air pollution. That should be a surprise to no one. But at the same time, we also did a wraparound wider communications campaign in the area. And if patients had seen or spoken to their health professional about air pollution in recent months and they saw this air pollution campaign, it meant that they felt much more likely to want to make changes in their behavior regarding air pollution. So yeah, that project has a report available on our website, and yeah, it is good reading, essentially. Fine. And having inducted these healthcare professionals to become what we call clean air champions, we essentially encourage them to get started. And it takes time, it takes practice, and eventually, after time, they can start to make it part of their everyday parlance, their everyday talking that they have with patients. Thank you, Maddie, for sharing that link. So yeah, that's the whole point of these, is so that people can talk to their patients about air pollution, and that takes time and practice, and we always recognize that. And then having done that, we also hope that these clean air champions will be able to share the learning with colleagues, and we always share the slides and everything like that. Again, there are freely available resources on our website about that too. Yeah. Good. Something that I hope will be particularly useful to, say, sustainability teams or those who are related to educating staff is that we have a free resource that we've developed across the last year called the Clean Air Academy. And this is essentially 7 short modules, each lasting about 10 minutes. So most people will complete in about an hour. And they're freely available on the they're freely available at that link there, essentially. And the great thing about those, while they were developed for a project down in Kent and Medway, we've kept them generic enough so that they're widely applicable across the country. One day I would hope that we would have things like this inducted into mandatory staff training, but unfortunately I don't think we're there yet. However, for anyone who is interested in learning more about air pollution, they can manage these in less than an hour, and they are CPD accredited as well. Fine. Last couple of areas I'm going to talk about, moving away from the education of healthcare professionals more directly, is talking a bit about the Clean Air Hospital Framework and the ICS framework that I mentioned at the start of the talk. And both of these would tie in towards green plans. The Clean Air Hospital Framework has been going for a bit more than 5 years now, and essentially that was developed with Great Ormond Street Hospital to start with, and it's almost a bit of a checklist of actions that the trust can take in order to reduce their contributions to air pollution and improve the air quality for their patients, their staff, and the wider public. So we have to recognize essentially that healthcare itself creates air pollution, and that we can work to minimize these contributions. The ICS framework was developed more recently, just a bit over 2 and a bit years ago now, and just in the last year has been transformed with a great initiative to turn it into like an online tool, essentially. And I would actually want to just very quickly blow the trumpet that Claire, who is on the call with us, basically designed many of these things, or at least was, very strongly involved in them. So it deserves applause in many of these respects. So anyway, the ICS framework, this looks at the ICS level, and it essentially encourages people to think about it in the bigger picture scenario, so that the trusts working together with local authorities, universities, and other institutions can tackle the problems of air pollution that a trust itself cannot manage alone. So ideally, we would have ICS level staff, or rather people within the ICB, registering, and then they can invite colleagues to actually join this. So if you've not heard of the ICS framework, that's just in the most recent link there, then I would send that on to your ICB sustainability team. Although I do think off the top of my head that all of the ICSs in London have actually signed up for the ICS framework, and it might just be that they haven't had time to really dig into it yet. Anyway, these initiatives, these projects are long term, and we recognize that we're not going to solve the problem of air quality overnight, and so yeah, it's a long term problem which requires long term thinking and unfortunately sometimes slow solutions, but it's all working towards the right direction. Fine. So this is the utopian hospital that we would like to see. And I don't need to read all these out to you, but essentially we've worked through initiatives such as the Clean Air Hospital Framework, or the ICS Clean Air Framework, in order to reduce the amount of air pollution that the NHS is producing. And yeah, it's the Clean Air Hospital Framework has been downloaded hundreds of times and used in hospitals up and down the country. And at the moment, we've got about 60% of ICSs across England have signed up to the ICS framework. So still a bit more work to do there, but actually, we're very pleased. It only launched in November, and there's been a very generous and enthusiastic reception for it too. Okay. So one sort of last plug here really, of course, is that while the individuals can make some changes in order to reduce their exposure to air pollution and indeed reduce their contributions, it does require larger, wider scale changes, both at the NHS level, at trust level, ICS level, but of course across wider society too. And that's why we have a picture of Westminster there as well. So yeah, it's definitely an area that requires governmental level input, and that's why, in particular, for this Clean Air Day, we're calling on healthcare staff and healthcare professionals to sign our letter, which is calling for it's calling for greater action, and it's calling for more ambitious targets relating to air pollution from government. So people will hopefully have heard of that, but we're now well over 300 signatures from leading healthcare staff across the country. And whether you are a frontline medical worker or otherwise just working in the NHS, we would still encourage you to sign. I also need, yes, that's a very good point as well. The point which has come into the chat there talks about green plan guidance. Now, of course, air pollution, unfortunately, at the trust and the ICS level is not a mandatory requirement to report on, but many trusts and ICS still do. It's sort of seen as an optional, and hopefully over time we would love that to change. But there are many, many good examples on, for example, the ICS Clean Air Framework, case studies essentially of how people have taken air quality action and tied it into their sustainability work to have benefits that go beyond that too. Anyway, I think in that interest of time, I will pass back to Maddie. My email address is there. I'll put it in the chat after as well. But yeah, feel free to reach out to me if you are interested in the healthcare education work. We work directly with some trusts, but also we can obviously make sure that you're pointed in the right direction for elements like that Clean Air Academy, etc., which are linked in the chat.